I kind of just always thought I would contract HIV because everyone else was. So I never thought I'd be 45 today.
Now, if you really wanted me to understand you, what would you want me to know about you?
Oh, that's a good one. That's a really good question. I am immensely organized and need structure.
My kind of guy. That connects us a little bit. You ask people about me, it's like everything has its unique space.
Well, most doctors do have that. Most doctors are very strict on that. What do you suspect motivates me to do the work the way I do? And I do like prep navigation, clinical protocols.
Well, just knowing what I've learned about you so far, even before you spoke, you are very organized even in your appearance. And I would imagine you bring that level of organization to bigger situations and contexts, which is a wonderful thing and a needed thing. I would wonder or suspect, is there an experience that you've had with a family member, with a friend, something that drove you to want to do it and apply it in this context? That would be.
Oh God, yeah.
Yeah,
yes, there was. I often tell people nobody's life has been more affected by HIV than mine. And some self-disclosure, I'm not positive, but I am a Black queer man, born in North Philadelphia, Richard Allen Projects, who has had I've had 3 family members who were positive. One of my closest friends was positive, and 2 of my aunts was positive. A lot of my family members were positive all throughout the late 80s and early 90s. And I kind of just always thought I would contract HIV because everyone else was. So I never thought I'd be 45 today. I never thought, okay, I'm gonna be 40, because everyone was dying around me. So what motivates me to do this work is that there was, oh God, I'm gonna go into another story. Oh God. There was this drag queen. She doesn't have the language of like sexual talk, but the way we build community, she would just be like, don't have sex. So, and if you do want to have sex, just do oral.
Oh.
That was her safe sex talk to me in 1994. So I honor that experience by, helping other folks navigate this landscape of HIV prevention and care. Yeah. And to me, they're one and the same. Care and prevention are one and the same.
Absolutely.
So, just making sure people have knowledge sharing and sharing the information.
Yeah, I think we all share that.
I'd like to ask you that question too.
For me, I think it actually goes back to how I evolved to do this in the first place. And at the time that I was training to be a physician, one of the stats that I heard about was the fact that for a woman who was my age at that time and ethnicity, that HIV was the #1 cause of death for that age group. And I was shocked. And I don't think it really has been, HIV has been among the top 5 causes of death for any other ethnic group or demographic in the last maybe 30 years other than Black women. And it's not as a result or a consequence of any personal behaviors. So that is what sparked the commitment. And then as I've met women who are living with HIV and hearing their stories, just wanting to, one, nurture them, but also for another group, prevent the circumstance, prevent the wounds from happening. So, that kind of frames it. I think we all come from a personal space in doing it.
Yeah.
What do you think is stopping patients and healthcare providers from speaking about sex and HIV openly in healthcare appointments?
There are so many reasons for that. One, we live in a very, America is very conservative and especially in certain spaces. And talking about sex can be uncomfortable for most folks. And we are not really taught as a society how to talk about sex. I wasn't taught how to talk about sex until I was like 25, 26. I think doctors and patients are starting to learn how to be more flexible in their approaches. And just when you say doctor, a lot of times, I found that most patients won't even bring up sexual activity unless the doctor does. So I often ask the doctors to bring it up with patients because the doctor is looked at as the authority in the space. So if the doctor brings it up in a very carefree, safe manner, the patient will probably follow. But it's just hard, you have to be vulnerable. You have to have your stuff together. I would say it's not going to happen in 15 minutes. It'll happen maybe within the 5th or 6th visit. But if you plant those seeds over time, it'll happen. Tell me about a moment that you truly opened your eyes to something previously misunderstood that a person living with or impacted by HIV was experiencing.
This is so hilarious, so don't judge me. I was on vacation and I was curious to see what HIV management was like in that place where we were on vacation. So I said, I'm gonna go and just walk in like a patient, like I know nothing, and get tested. And the more I sat and waited for my results, the more nervous I got. Now, I clearly anticipated what the results were going to be, but I clearly understood how anxiety-provoking that experience can be. And then what will they think? Because, I'd done tests before, of course, with colleagues who had done it. I've done home tests before. I've, done all those different varieties. But in that moment where, okay, what are they going to think if this is positive? And it taught me the priority given to ensuring that people are in a safe space when they do testing, when they receive the results and all of that, and then preempting that even with some anticipatory kind of guidance as to what will happen as the next step. What will we do with your test results? What's going to happen? Just giving people that full insight. So what's the best thing about what you do, and why are you continuing to do it?
Being able to be in a non-judgmental space, I have learned just throughout my profession to consciously not be judgmental no matter what folks tell me, because a lot of times people will leave little tidbits out, and it could be really important, and you're not necessarily giving them the right information because you don't have the
full disclosure.
So still a lot of the stereotypes and the misperceptions around the disease. I will continue to do this work until the epidemic is over. I truly believe it's going to happen in my lifetime. And I would not have shared that same sentiment 15 years ago. I never would have thought that we would be on the cusp of like all these preventative measures. And then, like I said, I still remember when it was just condoms and pulling out. You know, that was the only thing you had. What has been the most informative experience that has shaped your understanding of your work?
I think meeting people and hearing the personal stories. I mean, even what you've shared so far, different perspectives, different stories that abound. Yeah. And so I don't think I'm ever at a place where I'm not learning something new that I didn't realize before. So it just, motivates you to want to keep serving in that capacity. Okay. So what have you learned from this conversation that surprised you most, and why?
What surprised me the most was around how similar our stories are in many ways. I didn't know that doctors had these kind of experiences with, because doctors can be very stoic. They don't understand some of the cultural and ambiguity and traditions that happen. Right. And instead of exploring it, and sometimes you're not really given the time to explore it, you just dismiss it. And then that's where what you said, that disrespect. Rejected. So I appreciate you sharing your stories with me, because that will allow me to hear the doctors and nurses in our facility.
Give them a little grace.
Yeah, definitely. If we ever met again, what do you want me to take away from this conversation and never forget?
Never forget that everyone who's a part of the medical team that's taking care of patients, including the patient, is all equal. Everybody's role is sacred and vital to that person's experience who's coming to us and entrusting us with their health care and their health outcomes. So I would hope that you would go back to the Northeast knowing that you are at the top along with everybody else on that hierarchy. Everybody's valued.
Thank you. Thank you for that.